Welcome, everybody, to this week's episode of Boundary Breakers. My name is Piper, and today we are joined by Dr. Pam Durepos, an assistant professor at the University of New Brunswick's Faculty of Nursing, with over 14 years of experience as a nurse in neurotrauma intensive care. She has focused on research, particularly in palliative and end of life care, and her work aims to support family caregivers and people with dementia, ensuring dignity for both their patients and family members. So, today, why don't we explore some of the incredible journeys that Pam has been on, from frontline care and academia, her passions for mental health, and the importance of education and nursing? Welcome to the show, Pam.
Hi, thank you very much. Excited to be here.
We're excited to have you. It's been long drawn out. I'm so excited to get into this conversation because I think it's going to be so important to, kind of bring to greater light just some of the common everyday challenges or, misunderstandings about caring for those with dementia and having dementia.
Mhm. Yeah, it's my
So,
favorite thing to talk about. So,
perfect. So since this is kind of your shtick, why don't you kind of tell us a little bit about what you're currently doing and what's kind of brought you to this position today?
sure. So, yeah, like you mentioned, I've been a nurse for a long time, since 2003. Most of my career was spent in neurotrauma ICU, so dealing with people across the age spectrum, kind of all adults above the age of 17. But people dealing with a lot of life-threatening illnesses, such as, car accidents, head traumas, but then also a lot of people coming in with chronic illness and sort of, experiencing the progression of those diseases. Um, so I went back to school after being a nurse for 12 years. I went back to do a master's degree, and I was really excited to focus on more on palliative care, which we'll get into sort of what that means, but really to focus more on quality of life rather than just, how can we help this person live as absolutely long as possible. Yeah, and so, I went to school again for a long time, 10, no, 6 years.
I felt like 10 though, hey?
Oh yes, my husband constantly says I was must have been like another 20 years or something. Um, but I've officially been out of school now for 4 years, but now I work at a school. So now I work at the University of New Brunswick, which doesn't really feel that different than being in school. It's kind of the same. But yeah, my research all focuses now on a palliative approach, and especially for people living with dementia and their family members. So yeah, yeah, that's kind of where I'm at.
Okay, so a few things that stick out to me. What does it mean to have a good quality of life rather than just extending that timeline? And what is palliative care?
Yeah, good questions. So most people have pretty strong beliefs about whether they want to live as absolutely long as possible or if they're more focused on quality of life. It's not something I had ever thought about until I became a nurse, and I kind of
Mhm.
saw a lot of people needing to make decisions about, do we want to have this surgery? Do you want to have this kind of care? Where do you want to live? Kind of in the last phase of your life. So quality of life kind of means something a little bit different to everyone because it's based on your values about what's important to you. Some people are fine to, live in a nursing home and have lots of people providing their care, and other people that's kind of like that not something that they would ever choose for themselves.
Mhm.
So it's really a very personal thing. Some people all like maybe the best thing in their life is it comes from food, and it's,
Yeah.
so much meaning and enjoyment out of food. And they really feel that if they, can't eat the food that they want to eat, then that would be a very low quality of life for them. So
Mhm.
it's like a whole bunch of different factors, but it's very individual to the person. Yeah. And so then a palliative approach and palliative care, I'm going to get into it as we're talking more later in the presentation, but it's really an idea of focusing on quality of life. And that can mean helping people to extend their life as long as possible. But even whenever you're making a decision, it's like this focus on, well, is that going to help me feel better? Is that going to help me do the things that I want to do in my life, live where I want to live, see the people I want to see, and really focus on what's important to me.
I see. So, what's some of the, differences between person to person that you see where they put that value in different things?
Oh, yeah, that is huge. So I love talking about this stuff. It's not super comfortable for everybody, right? We're all different levels of, even being familiar with maybe where our values and beliefs have come from. I've had lots of time to think about this because of where I work. My family background is Catholic.
Hmm.
And so I've been brought up, even if I don't agree with it, very aware of a lot of beliefs that go along with that religion, which tend to be, prolong life through any means,
Hmm.
no matter what kind of care that requires. Um, but you'll find a lot of healthcare providers very much are more focused on, we see a lot of
Hmm.
suffering, and a lot of us have very strong feelings about, which kind of surgery we would want to have at the end of life, or which kind of procedure would we want to have. So I think there's a big part of religion, your culture, your family, what they've kind of taught you to believe in, and then your experience with what you've seen in your life, and it, helps you decide kind of what you would choose for yourself.
Yeah. Thinking about where I might even swing, because obviously we think that, you know, death is something that's so inevitable to all of us. It's like the only thing we're really guaranteed. Um, and you'd think that you'd want to, extend that as much as possible. But if you're in huge amounts of pain, if you don't know your own mind anymore, like you're not really happy, then I mean, it makes sense why you might choose to, maybe put a stop on that clock and just enjoy what you have for the time being.
Hmm. Yeah, definitely. And and that it's so different for each of us where we
Mhm.
place that value. There's a lot, I think, that comes from religion, but also culture, and even maybe how, people with illness or people who are aging, how you're treated in
Mhm.
your community, because
Mhm.
some people in some communities, like older people are really looked up to. They maintain this high, kind of social, like, I don't know, hierarchy where people really value them. And then there's other cultures, like a lot of Western cultures, we kind of make our older adults not feel so great. And,
Mhm.
when people aren't maybe able-bodied, they kind of make them feel like they're not valuable anymore. And
Mhm.
so that really is, is hurtful to people, and it would come into play in those kinds of decisions too.
Of course, 100%. And immediately my head went to the idea of elders and the position they have in indigenous cultures, right? And that's something that is precious and to be, valued, respected. And that's just not how all, communities treat their older individuals. So, why do you think it's so important that we start focusing and talking about some of these issues, whether it's dementia care, and even a little bit about that conversation we were just having? Why is it important to focus on services and, education around helping seniors?
Mhm. Well, even though I'm kind of middle-aged, I have had such a privilege to know so many amazing seniors and still know so many seniors. When I first started getting into this kind of area, one of the first things I got involved in was a support group for family caregivers of people who had dementia. And at that point, I had all of my grandparents had passed away,
Mm-hmm.
but I now became a member of a group where I had like 10 new grandparents, and they were so wise and also had so much personality and were so giving and had so much, you know, life experience to share. Um, that it was, I don't know, it was eye-opening to me because I was still pretty young at the time, and it was just a good reminder of like this huge sort of untapped resource we have and that we don't, you know, include as much as we should in decision making and like really draw from in terms of their strength. Yeah, and services they could just get much harder to access as you maybe have mobility issues or hearing issues or other, any kind of limitation. And so then it just makes it harder to
Mm-hmm.
reach those individuals who are our experts in the world. Like they've lived through everything and we have so much to learn from them. So yeah.
Yeah, you've hit the nail right on the head with that one. It's almost a sort of buried knowledge. Like these people have been around longer than the internet has like been out, and they navigated their lives in such a different way than we do today. And that's a resource that we're definitely, marginalizing a bit for sure.
Mhm.
So, while we're on the topic of, talking more, intergenerational connections is an amazing way that Elsie is able to, kind of share some of those senior experiences and whatnot. So, have you noticed in your research or in your working experience that there is a big impact that comes from youth and seniors interacting?
Yeah, I think some of our strongest relationships that we see are between like really young people and older people. I think there's such a higher level of acceptance, because I don't know, it's just with people like the extreme different ages, you don't focus so much on what you can't do and more so on what you can do. You're just kind of accepting of that, so and so does this a little bit differently than I do, and there's so much almost like a kinship there often. Even in the teams that I work in research teams, and teaching teams, the very best ones, the strongest ones we have are the ones where we have like junior faculty, middle faculty, and senior faculty, because we teach each other things all the time.
Mm-hmm.
And it really is just that diversity makes it so much stronger. And
Mm-hmm.
then we're all a part of different networks as well. And so it really just makes it, like all of the research more powerful, more inclusive of everybody. You're not just focusing on, like one tiny group of people that might be interested in what you're doing because you've included everyone's perspectives.
That inclusivity piece is something I didn't even consider, but is so apparent because each of these individuals, if you have, a junior member, a senior member, and then some people in between, they're in completely different positions in their lives currently, and they've been through completely different things. So having that range, I think, would provide so much insight and benefit and areas where individuals can trade ideas and bounce off of one another. And I think that that is definitely something that is missing in quite a few industries in our modern world today. Like, let's look at public office. Let's look at the Senate. That's very one note of individuals where we can see that having an array of different people, different backgrounds, different thoughts, different life positions is useful.
Mhm.
And honestly, more reflective of everybody, more reflective of the public, because we're all so different.
Mhm. Yeah, and people's priorities really range. So if you don't have people from different age groups and other, different demographics within these kind of decision-making bodies, you're really only thinking about that decision
Mm-hmm.
from one point of view. And,
Mm-hmm.
you know, we're all pretty different even now within our age groups. It's no longer like everybody gets, married at a certain time or has children at a certain time or attends school at a certain time. There's huge diversity within the age groups, but then definitely across it, it's such a wide, diverse perspective on things
Mm-hmm.
that really needs to be in all of these important decision-making places.
Mm-hmm. 100%. 100%. So I wanted to touch a little bit about what dignity means, whether it is in the sense of a caregiver wanting to provide dignity for the individual that they're working with, or just in the sense of what that might mean for someone that is, struggling with a sort of cognitive issue like dementia.
Mhm. Again, I think dignity, it's a little bit of a personal thing, but I think what's kind of universal is that we all want to feel respected. We all want to feel valued as an entire person and not kind of looked at as only an illness,
Mm-hmm.
you know? We want our physical body to be respected in terms of how, people might work with us or provide, whether people are helping us with bathing or eating. But we also want to feel, that our thoughts and ideas and spiritual beliefs are also respected. And I think something that's important for dignity is that we try to maintain those things for people, even if they maybe can't maintain them themselves anymore. We try to help them maintain kind of the practices, the behaviors that they would like to do if possible for themselves. Um, but I think it really comes down to respect and making sure that person feels respected and safe in whatever capacity they're in.
Mm-hmm. Yeah. So, do you see a lot of issues in whether it's care facilities or nursing homes or anything like that where respect and dignity isn't something that is, upheld?
Yeah, yeah, and it's always going to be such a challenge. And that's probably, one of the reasons I wanted to get more into palliative care because sometimes we felt like we were forcing care on people that it wasn't what they wanted.
Mm-hmm.
Um, it can be traumatizing to people, if they're not thinking clearly or they're in pain and you're forcing like some kind of care on them. It's really horrible. Um, but we sometimes prioritize things that
Mm-hmm.
they're actually not that important to the person, and
Mm-hmm.
we're maybe prioritizing the wrong thing. I have a really great colleague actually who does a lot of research around like perceptions of forcing care on people with dementia. And, maybe it's not important that everybody gets bathed every single day. If that's a
Mm-hmm.
really traumatic experience for them, what's the harm
Yeah.
in them, going a day without a bath or wanting to wear the same clothes for a few days in a row? We don't really actually know what the harm is, but we
Mm-hmm.
know there's a lot of harm associated with, frightening people, hurting people, holding people down. It can be really traumatizing for people. So unfortunately, yeah, that's a huge issue in any kind of area where you're working with people and you tend to have ideas about what care they should have, and we can sometimes ignore what care they actually want.
Mm-hmm. I feel like that we're starting to tiptoe into an area of dehumanization when you're treating individuals just because they might, be struggling with something at the time. Um, that it kind of removes that empathy piece. So, what are some ways that we can, prioritize these, sorts of values more?
Yeah, it's tough because it's a very big culture shift, and
Mm-hmm.
wanting and we're still kind of in this patriarchy, where we talk about wanting to be person-centered and give people more choice and make sure the care is, focused on what they want. But we still have this kind of hierarchy where healthcare providers are kind of like, we hold the power in the situation. We think we know what's best for you.
Mhm.
Um, I think more communication is just so important. People having more opportunity to do things like advanced care planning, where they tell people as much as possible in advance, this is what's important to me. And so
Mhm.
if I get into this situation, even if you think that's what's best, that's actually not what I want. That's not what's right for me. So I think the more we can try to do, advanced conversations, but also include people in the moment when decisions need to be made about their care, and
Mhm.
and their family members, because they usually know them best as well, and really try to value what they're saying. I think that can help.
Mhm. And I think we're, starting to discuss how agency plays a big role in that, and advocacy. What if they aren't able to advocate for themselves? I don't like this. I'm not comfortable with this. And I know, talking to a couple other dementia professionals, that that confusion, the mood shifts. I can easily see how that can play into that when you're triggered by something that sets you off, that makes you uncomfortable, and then you know as the caregiver, how do you deal with that if you're not you know thinking about it in an all-encompassing sort of way.
Mhm. Yeah, absolutely. And one of the things I love to say when we talk about capacity, like, are people able to make their own decisions, is like, capacity is on a huge spectrum, right? So if you're deciding if that person is able to make their own decisions for themselves or not, maybe they can't make a decision about, what stocks they're going to sell and which bank account to keep open, and, have I paid my bills correctly? They may not be able to make decisions like that, but they can probably tell you if they want to get dressed or not.
Mm-hmm.
Right? Like, and people can be pretty obvious about those kinds of decisions. So as long as people, have some ability to tell us what they want, then we need to listen, right? And there's still, yes, there needs to be conversation about, like, maybe something that is going to be harmful if they don't receive that.
Mm-hmm.
But then they should be able to have the option to refuse as
Mm-hmm.
well, because we live with risk. We're allowed to choose what we want, what we don't want, knowing that, okay, this might be harmful for us, or at least letting our families kind of, help us make those decisions if we're not completely able to at the time.
100%. What are some ways in your work that you have applied this sort of, thought process and, consideration?
Yeah. Well, I guess one of the ways is when I was working with this family caregiver group, it was interesting because we were in a setting of a hospital, even though these were people that were in general waiting for like a long-term care or a nursing home placement. But because it was more the setting of a hospital, they weren't included in a whole lot of decision making. Like, as much as they would have been in a nursing home where you're more actively involved in the care. When you're in kind of an acute care setting, there's an even stronger power kind of dynamic, right? So these family members, they really began to advocate for
Mm-hmm.
themselves. They were extremely educated. They were finding out all kinds of, things that could be done to help their loved ones that were living with dementia. So I've really seen a lot of advocacy, and it's interesting because of that generation, a lot of people didn't really feel comfortable speaking up against, say, a physician or a nurse
Mm-hmm.
practitioner, because they felt like concerned about, they were just used to that person being the person in power. Um, but a lot of them, I've really seen them advocate for, my family member knows what they want, and I'm okay if they fall because they don't want, we don't want them to wear a seatbelt because that scares them and makes them feel restrained. Um,
Mm-hmm.
so I think there's a lot of empowerment happening in terms of people feeling more comfortable to speak up uh,
Mm-hmm.
about their needs and their loved ones' needs.
I'm glad to hear that. And, I think it is great when, members of civil society, us regular Joes, do use our voice in, the biggest way possible because, it's sometimes it can, feel a little, what's the word, sinking that we don't have as much power as other individuals in society. And that's definitely something that plays into the whole power dynamic of, doctor versus patient. Um, yeah, so I think that's really great that, more people are starting to speak up about it. So we've talked a little bit about, I like the advocacy piece, agency, some of the everyday things that we're trying to implement into, the norm of dementia care and whatnot. So let's take a look at the flip side and talk a little bit about the caregiving piece. I remember that we talked quite a bit about burnout, your own experience with burnout at that too. So, in such a high stress work environment, especially when you're considering things like empathy and people's agency and whatnot, how can you know, those in the higher position, the professionals, be mindful not only of, their patient and how they're feeling, but for themselves too, in, guiding this sort of relationship.
Mhm. Well, it's pretty cool. There's so much new research about resiliency and especially in like first responders. There's so much more awareness now and talk about things like PTSD and sort of acceptance that, this is a real thing and that we all need to be caring for ourselves and you can't, pour from an empty cup, all those kinds of things. Um, it's really hard at an organizational level to get the right resources in place. Pretty much every place I've worked at has had the employee assistance plan, which is, like a certain amount of free counseling and resources and stuff. Um, but in, first responders, such as like in police and paramedic, my daughter's actually in a paramedic program now. They tend to have more organizational things set up, like where you automatically attend counseling if you've had like a really challenging situation, or you automatically get a certain amount of time off if you had a difficult death or something really traumatic happening to you. We don't see it quite coming into nursing as well like that. So there is definitely more available, but there is a lot of onus on yourself to kind of figure out how to care for yourself. Um,
Mm-hmm.
some of the really good stuff that I've seen, and I'm trying to recall the authors. There's some really great authors that write about the stress cycle and needing to complete the cycle, so that, when this stress builds up in your body from like a really difficult or challenging situation, you need to plan and actively do something to get that stress out of your body. And for a lot of people, that it has to be something active, like exercising, like walking, like, I don't know, just even, I don't know. I think there's even, exercises like doing like squats or something like that. But there's this physical component that we don't always talk about. We know it's healthy, but there's actually that your body needs to do something to get this energy out after kind of a significant event that you might have. So the exercise thing, or, the moving your physical body is so important. There's some really good research coming out about how to cope with shift work,
Mm-hmm.
that that we need to be telling new people that are going into these demanding kind of careers that tend to have shifts,
Mm-hmm.
even things about, how to keep your circadian rhythm kind of more even as you're going back and forth between nights and those things build up. Um, The more kind of night shifts you do, the more dysregulated you can become. There's, new like kind of sleep masks and earplugs and all kinds of new gadgets to try to help improve our sleep cycle, which we know affects all parts of our body as well.
Mhm.
So yeah, those are a couple of the things I think
Yeah.
are cool.
Well, it makes sense, right? Like, if you believe in evolution or not, like, humans are animals at the end of the day. Like, we have teeth, nails, we can think, we have really great eyesight. That's something a lot of animals would be envious of because we can see so many colors.
Mhm.
But the idea of working through anything makes complete sense. And um, I like the way that you portrayed stress as a physical built up thing. Like, um, tension headaches is another thing that I've personally dealt with myself. Um, but that is so, like, it takes a different perspective for sure. And looking into these high stress scenarios where your work is very demanding, you're there for long hours. I immediately thought of my mom in shift work. So my mom is almost 50 and she's been working um, at site driving the big trucks on the oil patch for quite a few years now. And that shift from day to night has always like been so hard for her because it's like, can you really sleep in the middle of the day after you already went to sleep last night and then have a nap so you can go to work? Like, it's discombobulating. And when she gets off her first day, she's right off, and it's her day off, but it's like you need sleep the whole time because you're like so, out of whack. And she is, it's middle age, right? She's definitely getting up there for sure. So think about how that's going to keep impacting people over the years and how it's going to impact young people starting off, in this sort of, environment that makes us completely flip on everything that we practiced priorly.
Yeah, yeah. And it's so hard on families as well, right? Like I worked straight nights for a long, long time. And to do that, me and my husband, we worked opposite. He worked days, I worked nights so that we could, you know, avoid needing a whole lot of daycare. And in these kind of jobs, you're not just sleeping somewhere else. You're doing difficult, heavy, emotional
Mhm.
work at night. And, even these topics about, dementia and death and dying, so much like really important, powerful stuff happens overnight that those night shift workers are dealing with all the time. That like these
Mhm.
really hard conversations and, people struggling with their behaviors that might happen, more so at night than in the day. Um, yeah, so it certainly takes a toll. Yeah.
Mhm. 100%. And I remember you brought up capacity earlier. Let's talk about capacity in nurses. So I'm sure this doesn't go for, all hospitals, all nurses and whatnot. But I've heard of the 24-hour shift. What is that all about?
Yeah, some people will say that they would rather work for 24 hours. I've never worked for 24 hours. I don't think I could. But there's some environments, especially like flight nurses,
Hmm.
you're on until this job is done. Like
Yeah.
there's no in between. You're there and there's no replacement for you. So uh, I think I know there's lots of research that shows the longer you work, like in a shift, and the more shifts you work, like there tends to be more mistakes. There tends
Hmm.
to be, more safety things that happen. But we're talking about people who are nurturers and cares, and they're willing to do whatever has to be done to get the job done, right? And so, if somebody calls in sick and we're really short staffed, there's usually people who will volunteer just because there's a need, and people are, used to putting the needs of others before their own. So yeah,
Hmm.
yeah.
And like another thing that's confusing about that for me is that, they're all we're always in need of more nurses, and I feel like nursing is one of the most, you know, saturated education, stems like to get into. Like there's everyone is always like applying to nursing school and going to nursing school. So does, all of that stress and going through your practicum and all that stuff, do you think it, makes some people want to step back and maybe not go into that field? Like how come we don't have uh enough nurses, and some people are forced to do the 24-hour thing?
Yeah. I know in the where I am in the province of New Brunswick, they found right now that there's a huge number of nurses that are leaving after 1 year, not from school, but like from practice, which is
Yeah.
pretty scary that they went to school for 4 years, most of them, and are now like the environment is just that they're short staffed. We have huge amounts of retirement. We knew this was happening 10 years ago, and we didn't do enough workforce planning. And then we lost a lot of nurses during COVID because
Mhm.
just like the stress of the
Yeah.
situations, people just couldn't work anymore. So people took early retirement. And I do think that, we've got our values have shifted a little bit. People are not always so, willing to stay in a job that's really, really tough for them now. There's a lot of options out there for part-time work or travel work, to being a digital nomad. I talk about becoming some kind of a baker or something. I think that a lot of people don't stay in the profession as long as, maybe historically when people would go into a job and it was like, that's it, this
That's
is
it.
you for
That's
the
me
rest
for
of your
life.
life. Exactly.
Mm-hmm.
And people have so many options. I mean, as a nurse, you can work in a lawyer's office, you can do aesthetics, you can work in long-term care, you can work in public health. It's hard to keep all of those sectors full for sure. Yeah.
Yeah, 100%. And if you have options, and like at the end of the day, of course you want to help other people, but you came into this world alone and you're going to leave alone too. So if you're not, you got to think about yourself sometimes and be selfish, especially after you've devoted so much of your own energy into, wanting to help others. Like that's the purest thing that I could even think of doing. So yeah, I completely understand why more people want to move into baking and, digital nomad
Yoga
work and whatnot.
instructor. Yeah,
Yeah.
yeah. Exactly.
Totally. Yeah. Okay. So while that is an option, I would love to hear what changes you think should be made, or, sites and goals we should have to alter or aid the education or the healthcare system, and those that are, most impacted, the workers and, the patients, to better support this aspect of burnout, high stress, and all the things that come with intensive care.
Mhm. Yeah, so the biggest things that have come out from research is really the importance of mentorship. It's having, junior nurses paired with senior nurses that they can learn from and grow alongside. The units that are really having a hard time keeping nurses are the ones where it's all young people,
Mm-hmm.
and so you don't have those people to look up to, the person that can be your resource. Um, I was pretty lucky when I went into the ICU that they had a new role for a resource nurse,
Mm-hmm.
because there were so many new people coming in at that time that they realized the need for that person to be a mentor to the new people coming in. So I was fortunate. But they're struggling to find those mentors right now. We definitely need to do a lot better with retaining the nurses that we have, because there's a huge focus on how do we, attract people to work in the hospitals, to work in long-term care, what kind of incentives can we give them? But there's people that are there working that
Yeah.
are your experts that we really need to focus on retaining.
Yeah.
And the new people coming in, they won't stay if there's no senior people for them to look up to, for
Yeah.
them to coach them and mentor them along. So I feel like retaining the staff is almost more important than attracting the new staff, because by retaining the staff, you can create a positive environment where people feel like they have opportunities for professional development, they're able to get, their vacation time, their seniority means something. The young people will come, the new people will come because they know it's a good, safe place to work where they will be supported. Um, One other thing is the real, like, education is just so expensive,
Mhm.
and it's really makes it challenging for people to go into almost every aspect of healthcare. And there's a lot of places like around the world and even some provinces where they've identified these gaps, like we need more nurses or we need more, respiratory therapists or a specific healthcare field. And they've made those programs free for a certain period of time. That's how you're going to get people in.
Mhm.
Because people still have to take time off of work. It's still going to, hurt them but financially, but at least that cost of them going back to school is covered. Um,
Mhm.
so we really need more programs like that to enable people to go back to school or to go to school after high school and fill these positions.
Yeah, 100%. And thank you so much for bringing up this, pivotal pillar to not only education or career, but, to human life. Mentorship is so important. We were kind of talking about this earlier,
Mhm.
even though we weren't directly, but the aspect of being trained by someone that has already done it rather than, oh, I've read my books, I've done my tests. Getting thrown into the mix is not the same at all. How are you
Mhm.
supposed to do that without a, model to model yourself after?
Mhm. Yeah, absolutely. They managed it pretty well in my unit, where they would look at we would work as a team, and they would try to make sure that all of the different teams were balanced, that you had a couple seniors, you only had a couple new people at a time, and there were some people kind of middle of the road. And it created a lot of stress on those seniors. It did. But it also, it made it a well-functioning team because you knew you had those resources to go to.
Mm-hmm. You are so right about that. I'd like to link a couple things together now. So, education, mentorship, teaching. How do your, experience and background, um, and just, knowledge base of dementia and mental health link with palliative care, and how do you hope that, these sorts of, thought processes, strategies, and factors might, rub off on either people that have been in the field for a long time or the newer people that are just, getting into it.
Hmm. Let's see. That's a big question. How does this all relate? Well, I'm really passionate about palliative care, and it's when you'll hear when I talk about it as being a philosophy of care.
Mhm.
And I think that that philosophy can be applied to everything. Like, if we look at just wanting to focus on making, the best experience possible, making it as inclusive as possible, treating everyone holistically so that they're not just, a physical illness. Every person has spiritual, cultural, social components, that are equally valuable. I think you can bring that to every every part of education, and I think it really helps people to succeed and maybe hopefully enjoy
Mhm.
their education because they feel valued as a
Mhm.
person, right? More than, you're not just a student, you're not just a grade, you're a whole person, and this little grade is just one little thing that you did. um, so I hope that that attitude towards sort of care, teaching, life in general kind of gets filtered through to students. I also think that if you're treated with respect and kindness, you treat others with respect and kindness. I think, the people who have been hurt really badly and treated really badly, they go out into the world and hurt others because that's just your kind of reaction. It's like a protective reaction. So if we can, teach students and teach everyone that, you hold value and I respect you, we are all equals, then they will hopefully bring that into whatever they do and just expect that for themselves and then, integrate that into their own behavior as well. So,
Hmm. You never know how something you say is going to have a big effect on someone. Even if, and like, obviously, none of us are perfect. You know, that moment where you're walking away from a conversation, you're like, damn, I really wish that I didn't say that. I hope that they forget that. And then you think about it for like weeks on end. Obviously, I'm talking from personal experience here,
yeah.
but that comes from a place of some things have stuck with me and have really changed my outlook and how I step into the world, how I think of people, how I think of relationships. That all sticks with you. We got all of our traumas, all of our education, all of our experiences. They're all stacking on top of each other to, create a totem of us. And yeah, so I mean, being mindful and, you know, we're getting into cheesy territory now, but, you know, we got to treat other people how we want to be treated because we're all reflective. We're feeding off of one another's energy. And if more people are cognitively thinking, like, oh, I don't know if I should, maybe I should think about this a little bit first, there's going to be a huge impact in that. And I love what you were saying about the classroom, how it's more than just a grade, how it's more than that. And something that I encourage more people to get involved with in is, raising your hand and joining in discussion. Not only are you going to understand the content so much better, but a lot of it is based in social anxiety. Oh, I don't know if I want to participate. What are people going to think? What if it's wrong? And what? And what if it's wrong? Like you're gonna, stand out, maybe have a relationship with your professor.
Mhm.
Obviously a professional relationship. Don't get anything
Yeah,
twisted.
yeah. No, no.
But and you might have something to say that is gonna be really impactful to another person. So, you know, throw caution to the wind, like
No,
you only live
absolutely.
once, all that stuff.
Yeah, no, absolutely. Those are the students that you get to know. It's
Mhm.
so fun, when
Mhm.
somebody speaks up and you're just like, as the teacher, you're just like, oh my God, somebody said something. This is like the
Mhm.
best thing that's ever
Mhm.
happened.
Mhm.
Because we get so sick of hearing our own ideas, right? I mean, even again, that generation gap, we want to hear what other people have to think and
Mhm.
say about this. And we know that learning comes from applying what we're talking about to your own
Mhm.
situation. Until you
Mhm.
do that, it doesn't go in. So by asking a question, you're already in that process, and yeah,
Mhm.
it's valuable for everybody. So yeah, I agree with
Mhm.
that.
And you are so right about that. A lot of people, and I mean, I feel like everyone does this, but you will put someone else's, whatever they say, their experience into your own mind and, reflect it in something that you've done. And I've heard people mention that it's like, oh, you always make everything about yourself. And it's like, no, I'm just like, I'm trying to understand what you're
Mm.
going through. So, I mean, that just comes back to we need to talk more. We need to be more engaged. And, we've kind of come a little bit full circle right back to what we were saying about this intergenerational piece from earlier. And I'd swear that wasn't even planned. That's
No,
just how
no,
it
it just
happened.
happened. Yeah, yeah.
Uh, while we are in our last couple minutes of our special, I'd love to open the floor up to our audience members. If any of you guys had questions for Pam while we've got her live, and while those are cooking up, I'm going to ask you a couple more little wrap up questions. So, is there anything you would like to share about upcoming projects or initiatives that you think our audience might be excited to hear about?
Oh, sure. Let's see. I was just at the Canadian Association on Gerontology conference. It's an amazing conference. There were some wonderful things I learned about that are coming out of Advanced Care Planning Canada. They have some new tools that are like conversation guides and kits for some of these talks that are hard to have in your family if you're not used to talking about them. So that's through Advanced Care Planning Canada. In New Brunswick, actually, we're trying to get as many nursing homes or long-term care homes as possible to enroll in our SPA LTC project that we're working on, where we are giving education to staff to try to help them better deliver a palliative approach in their homes. So we're doing that, and we had lots of people in our first round that we did it, and we're trying to get even more this time. So it's really great, and we want to get as many people involved as we can here in New Brunswick. Um, yeah, the SPA LTC program is also going on across Canada. So if you're a healthcare worker in any kind of long-term care home or any kind of worker, doesn't have to be health, you can always look into the SPA LTC program. And there's lots of free resources and education that might be valuable to you in your home.
You heard it here. Check that out if you think you might be, if you might resonate with that program, and maybe we'll be able to put some links and make it super easy for them to find your page. We received a question in the chat. So, in your circle, do you know of any professionals researching the physical and psychological issues related to aging?
I know a lot of people doing research on aging. There is in Canada, the biggest one that's looking at sort of cognitive changes as people age is called the CCN or the CCA, the Canadian Cognitive something Association. But it's also across disciplines because there's people in gerontology doing this work, people in kinesiology doing this work. Um, but I could definitely connect, if there's a certain thing that you're looking for.
Yeah, I mean, I think that would be amazing. So we can even be in contact, see what happens. But I think that's a very interesting domain for sure.
Mhm.
So, I mean, I think that works for the other question I was going to ask. So, why don't you tell the audience any final key takeaways or advice that you may have that you think might resonate with them?
Um, I I didn't talk a whole lot about dementia here because you guys had the most amazing person do an episode on dementia a little while ago, that I thought was fantastic.
Mm-hmm.
Um, I guess I would be happy for everyone to know that palliative care is not just at end of life. It is meant to be an approach throughout the time that someone has a chronic illness. Everyone can benefit from a palliative approach and palliative care. So it's a cultural shift trying to, change our mindset about what that means. But I would say if somebody says, oh, your family member has an illness and we're going to get palliative care involved, that's great. You want them involved because they will make their life better. They will make your life better. It's not something to be scared of. It's something to welcome. So yeah, I guess that's what I'd share.
Well, I think that is definitely something that is going to be eye-opening because until we've had this conversation, our original conversation, I've never heard of palliative care before. So
Okay.
hopefully this is, a learning place for anyone else that may stumble across this video and maybe something for them to look into. We've talked about agency, we've talked about burnout, we've talked about being human, connecting, our faults, our benefits, how, society has changed and how we've changed with it. And I think this has been an amazing conversation. I'd love to thank you, Pam, for, coming in, giving us a little slice into your brain and, see the inside of what, nursing and education and mentorship looks like today, especially when related to, intensive care. And I'd love to thank our audience members, especially those that, interacted with us a little bit in the chat. We really appreciate everyone that's, looking to learn more about one another. Like that's so human, and that's definitely something that, we should make use of while we're here. Like, we don't know what tomorrow will bring or yada yada yada, but this is what we do have right now. So thank you everybody for being involved in that.
Thank you.
I think there is another question being made up in our last couple minutes, but I'd love to take a picture with you. So, you mentioned your technical expertise and its level.
It's
So
limited.
let's do a little bit of a run through. So you see your little tile with your face on it, Pam?
Mhm.
If you click your three dot button and then you go to, okay, wait, I gotta go to my own. Choose virtual background
Okay.
and then go to video filters.
Hmm.
There are a bunch of different things in there. I'd love for you to take a look and be like, this connects to something that we talked about today. And then I want you to give me a spiel on it when you find one. I'm also going to be doing the same thing.
Okay. Well, I'll probably pick the butterfly. Right, it says butter freckles.
Okay. Well, I am choosing this education hat because,
Oh, cool.
we talked so much about, education, mentorship, learn knowledge, buried knowledge. So I think this is a perfect reflection of some of our overarching concepts today. Now, give us a bit of a spiel why you picked the butterfly freckles.
Okay. The freckles thing, I'm not sure about. Um, but it's because in palliative care, the butterfly is often a symbol of someone who's dying, and we'll often use it as a kind of a discreet but also meaningful way of letting people know that someone is dying, and they'll often put like a sticker on someone's door or a sign outside their door, just to kind of show that they're transitioning. And so people, if you see their family or you want to come in and say goodbye or visit with them, it tends to be a very nice symbol and kind of outward sign of that.
I think that's such a beautiful sort of metaphor and imagery because, of course, the phases that, the butterfly goes through, the caterpillar and then in the cocoon, and then they burst into a butterfly, and then they're, very fragile. If you ever touch a butterfly's feathers, and ruin their little powder, you can easily tear their feathers or their wings. And then what can they do if they can't get around? And then I mean, now we're getting into a big thing about quality of life. So I'm like,
Yeah.
I could write a whole essay on this just with the
Yeah.
ideas of where my mind is going. But I think that's a beautiful metaphor. So let's pose really, and then someone will cut it in post. Okay, ready? Just to
Okay.
commemorate today. Okay, we look beautiful. All right, we have one final question, which, if you don't have any names per se, we can follow up with that later, uh, afterwards. But do you know of any individuals and professionals in this domain that are researching intergenerational connection and its benefits to physical and sociological issues and aging? That's kind of the same one as earlier.
Probably just more specific.
Mm-hmm.
There's a lot of universities who have intergenerational studies going on, especially related to housing. We have one at the University of New Brunswick. I know where I came from at McMaster. They're also doing studies in that area. So I don't know the specific researcher. Um, it would be at McMaster. It's the McMaster Institute on Aging Research that is looking into that, especially the effects of the housing, of housing older adults together with younger people. And there's huge benefits, especially for both parties, but for things like that with the older adults. Um, and we have a thing like that at the University of New Brunswick too. But yeah, I'm sorry, I don't have the names of the people that are leading those studies.
No worries. I'll shoot you a message later on. But yeah, once again, roping back. Thank you everybody for coming, and thank you so much, Pam. I've had a lovely conversation with you today, and I hope everyone has a lovely weekend. TGIF, time to rest if you can. Time to grind if you can't. It's midterm season after all, for all the students out there. But yeah, let's catch everybody in the next one and continue to break boundaries.
Okay. And thank you so much for having me. This was great.
Of course. Thank you so much for coming, and thank everybody else. All right. This is it for today's special. Thank you everybody.
Thank you.
Okay, we are good.